We all have our own ways of keeping things clean, but sometimes doing things differently can be even better. Dentist Steve Marsh is here with spring cleaning tips for your teeth that you do need to try. Welcome back to the show, Steve.
Thanks, Lori.
Now, we brush after every meal, we floss, we see the dentist twice a year. It's all the tried and true traditions, so why do we want to change?
Well, you know, just like our houses get older and they may need more repairs, the places we live, our cars, teeth age the same way. And a lot of our viewers had teeth filled and fixed when they were very young, 20, 30, 40, 50 years ago. They may have broken down, the teeth may have shifted. So with adults, we actually have people come in usually every 3 to 4 months to maintain things. It's much easier to maintain things than to fix things, quite frankly.
How about changes to the flossing and brushing we're all used to?
So one of the things you may notice is as we mature, sometimes when we were young, our teeth may have been tight against each other. And in that case, it's good to use floss. But as we get older and teeth start to shift and open up.
I've experienced that already, yes.
Right, so in that case, floss isn't as good as some of these brushes that we have. We're very big on these brushes. I'll try and hold it down here. And it literally can get into those spaces. It's almost like a triangle opens up. So flossing is good when the teeth are tight, but as they start to move and open up, these little brushes are wonderful. They're also wonderful when you go out to a restaurant and you get something caught, you can run to the bathroom and use that very easily.
And that food gets caught as you get older, doesn't it?
And I might also say that with arthritis and things, it may be a little tougher to get to, and that's where these brushes are wonderful. And sometimes your mouth gets dry because of lack of saliva. It can be because of medication as we mature. So it's even more important to take care of our teeth and keep things as clean as we can.
Okay, and you've got some examples of cleaning up some smiles that may be more than just the routine, right?
Right, and these spaces have actually led to them. And we have a number of patients to look at. This patient came in very recently, and he said in his family the teeth were always spread, especially in the front, sort of something he inherited. Somebody did a crown on one tooth because he had a root canal, and then there's space between. He said every time he eats and he's with people, food gets caught. You can see how dark the adjacent tooth was. We just did some reshaping, Lori. We took off that old crown, removed some decay, and then we closed the space. And because he was in recently, and I knew we were going to do this segment, I said, how's it been? He said, for the first time in a long time, he can food, spinach, meat, and doesn't have to worry about the food getting caught between teeth.
That's always nice.
In this patient, we talked about things opening up. Sometimes they close up. That's also part of shifting, and very, very common. So you can see the patient on the left. This is the same patient. Midway through treatment, those teeth had shifted a lot. Again, food collected. A lot of tartar collects when the teeth are tighter. So we reshaped those. In the bottom, all we did was reshape them. You can see recontoured them. Here's the same patient. You can see what she looks like. We've done some porcelain veneers after the reshaping. That porcelain makes it easier to clean, less debris gets caught, and also ensures that those teeth are going to last her the rest of her life. This is a really interesting one. This gentleman came in, Lori. You can see his teeth had split. He kept getting food caught. He was very diligent, and actually by going back and forth a little too much and the gums receding, he opened up these spaces. He came to me with that tooth broken off. His dentist had told him maybe we ought to look at dentures, and I said, I think we can use those as a base and do an all porcelain bridge. We have a very strong porcelain called zirconium. We use some pink porcelain at the bottom to give him this beautiful smile. And since then, now he's learned about modern dentistry, he's actually going on to his upper teeth.
All right.
Let's see if we have one more coming up. We may or may not. And again, one more. This is, again, that shifting we talked about. So not only do they not look as good, but more importantly, in this case, too much food was getting caught. So we reshaped him. After reshaping him, did some 4 porcelain veneers without braces. Patient was actually about 65, got a beautiful smile, but more importantly for us, in terms of this discussion, less food and debris got caught. So there's things we can do to prevent it. Once things have happened, sometimes we can even make it better.
All right, great information and pictures. When it comes to taking care of your teeth, the work is worth it. Need help greeting the spring season with a clean, healthy, and happy smile? Give Steve a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.